Hello, Pana, how are you? Okay, last night you wore the Embolata device, you brought it back for us, and we were able to download the report from the device, and I'd like to share some of the highlights with you because it appears that it's a good thing that you came in and we were able to put you through the tests because there were some significant signs of apnea that we were able to display on the exam. Now, you remember what you went through yesterday when we did the initial tests, which verified to us that there was significant collapsibility of your airway, which led us to test you with the Embolata at home. And some of the numbers that we saw are probably ones that you're not so surprised with. The apnea hypopnea that occurred during the nighttime, you had 51 times an hour that you actually stopped breathing. And what that does is it really lowers the oxygen saturation in your bloodstream. That means you don't have a lot of oxygen that's going into the blood, that's nourishing the cells of your body, that keeps you fatigued, that keeps you tired. And this puts a lot of stress on your heart and your circulatory system. And that's why it's so very important that we get that airway open somehow. In addition, if we looked at the snore time, you had 32% of the time that you were on the device, you were snoring, which means that your body trying to open up that airway by vibrating to try to open it is putting a lot of strain on your system. And there's a lot of different pieces of information. We're going to send this off to a sleep doctor who's going to verify these measurements for us, but I believe what he's going to come back with is at least a obstructive sleep apnea diagnosis. One of the other issues, which I think is what I just pointed out, which is very important, is the lowest oxygen saturation was at 76%. Just to give you an idea, normally we like to see people at 96%. So at your lowest reading through the night, when you really had these episodes where you stopped breathing, your oxygen saturation went down to 76%, which is very, very serious, very, very low. So what we're going to do is we're going to send this report out to a local sleep doctor that we work with. He's going to verify what we saw, make sure that we didn't miss anything. If he verifies this, what we're going to then do is do what we thought we were going to need to do yesterday, is take those examinations over again. We're going to do the volume of your airway, and again we're going to do a collapsibility study, but we're going to do it when we change your bite. What we're going to do is I'm going to have my young ladies come in. You remember the assistants that went over with you yesterday and did the exams, and we're going to put these little blue devices in, these little blue, the bite marks. What's going to happen is you're going to put your teeth in, they're going to tell you where to bite in these bite jigs, and these jigs are meant to open your bite and to advance your jaw, and by advancing your jaw and moving your lower jaw down and forward, it opens your airway. And if we can see that there's a significant change, an improvement in the collapsibility, we don't get as much collapsibility of your airway, and we can maintain it. We can maintain a more opened environment for air to come through. We'll then go ahead and proceed to an oral appliance that would mimic the bite that we have analyzed on these tests. So that's what we're going to do right now. It shouldn't take that long. And if we can see that we can gain an improvement with jaw posturing, with an oral appliance, we'll go ahead and fabricate that appliance, have you back in, and then see how you do with that. And then we'll redo this study after the oral appliance has been placed. Okay? I'm hopeful that this will be something that will be life-changing for you, and I think it's something that is very, very important. So this type of process that we're putting Pana through is really something that is different than anything that most dentists go through. It's something that we've probably seen a lot. We're always in the oral cavity evaluating the soft and hard palates and the teeth, and looking out for oral lesions and oral cancer. And this is sometimes often overlooked, is the fact that a lot of our patients have obstructive sleep apnea that is undiagnosed. So this is an opportunity for us to help our patients with something that is typically underdiagnosed in the United States and probably around the world. So let's see what happens when we go through these next two tests and see how we can help Pana improve his sleep apnea to the degree where he can actually breathe normally at night, minimize his snoring, increase his oxygen saturation, and in fact increase his life quality. Not so tired anymore. Okay.
Okay, we're back with Pana again today. He went home, he had the sleep study done, he wore the Embolata device, he came back in, we downloaded all of the information that it gave us. It was diagnosed by a doctor that he does have some sleep apnea, some obstructive sleep apnea. So now what we're going to do is we're going to try to find a good position for Panah to make him an oral appliance and see if he's a good candidate for an oral appliance. So what we're going to do now is we're going to use the same pharyngometer that we used before, but we're going to actually use little bite jigs to see if we can pull Panah's jaw forward and have him open enough so that he can get enough air in without being obstructed. So Panah, what we're going to do now is we're going to use these little jigs. They're little plastic pieces. I'm going to put them in your mouth and they go between your teeth. And what it's going to do is it's going to have you open. It's going to pull your jaw forward just a little bit. And we're going to do the same test that we did before with the pharyngometer that we did before we ever did your sleep study. And we'll see if that opens your oral airway enough that we think you might be a good candidate for an oral appliance. Okay? Okay, so I'm going to have you open for me. And then I'm going to have you pull your lower jaw forward just a little bit. Now close for me and bite. Good. Okay, and we're going to start here. I want you to stay closed on that. And we're going to use the same thing we used before, okay? And it's going to be a little bit more tricky. We're going to work this in just like we did before, okay? It's a little trickier because we've got that little jig in there. And then I want you to try to keep your tongue real still for me, okay? And then I'm going to have you hold your nose. Perfect. Okay, and then just breathe normally. So now we're going to do one more, just like we did before. I'm going to have you hold your nose for me. Then I'm going to have you breathe normally. Then I'm going to have you take a deep breath, okay, and then blow it out all the air. Okay, open for me. No, don't open. Okay, you ready? Good. Good. Okay. Now take a deep breath for me, and now slowly blow out all your air. Keep going. And when it's all, you just give me a little tap when all the air is out. Now, don't open. I'm going to take this out, okay? Okay, you doing okay? You can stop holding your nose. Relax for me. Good. Now, we may have to go through this several times and use several different jigs until we get the maximum amount of airway for him. And once we get that, then we'll take a bite registration and some models, and if he's a good candidate, send it off and have an oral appliance made for him to wear at night.
So we went through the Embolata overnight testing for the patient. We've seen that there's certainly something that would lead us to believe that there's a significant obstructive sleep apnea as a diagnosis. We had it verified by a local sleep doctor. What we wanted to do is to test whether or not an oral sleep apnea appliance can be inserted in the mouth that would stabilize and open Panah's airway. And what we did just now, what you've seen on the video, is our assistants went through a number of different positions with these airway metric devices, and these are just little bite jigs basically that position the mandible downward and forward at different positions for bite opening and mandibular advancement. This obviously allows for an opening of the airway, and what we want to do is then test that. Several of them were put in the mouth, and we did several secondary collapse studies, and what you're seeing on the screen here is this was the original study done without the metric bite openers, bite registrations placed in the mouth. This is with the mandible positioned forward and downward. And what we did is we did 5 millimeters forward, 6 millimeters down, and what you'll see is a substantial improvement in Panah's airway. What we have here and what we started with as a mean is 0.74 cubic centimeters in terms of opening, and the mean went up to 2.86, almost over a 300% increase in his airway. And then the minimum, which is so important, where does it collapse to in terms of the volume that's lost when he's sleeping, when he's on his back, when he's snoring? And originally went down to 0.4, which is a substantially small number, like breathing through a very small straw. And with the appliance in place, we've increased that to 1.22 centimeters. So we have a substantial improvement on both numbers, which would lead us to believe that oral appliance therapy in Panah's case may have a significant improvement on his symptoms of sleep apnea. We're going to take him through that. We're going to order the device. You're going to see us insert it once it comes back, and we're then going to have him return to us and take him through the same studies that we've already done to verify the improvements have been made. If those improvements have not been maintained, we'll maybe make alterations or improvements to the appliance and jaw position. If that doesn't improve, then obviously the next step would be possibly CPAP machines and making sure that he can get his airway opened through an external device of some kind. So we're going to take you through that. We're going to install the appliance when it returns from the laboratory, and then we'll have more of an information on Panah's improvement as we're able to evaluate his numbers.
Okay, Dr. Salama came in and took a look. We tried multiple different jigs with Panah to open his airway, and this was the best result that we got. Dr. Salama came in and took a look at all the data. So what we're going to do is we're going to put the jig back in Panah's mouth. Close for me, Panah. Perfect. Good. And with him in this position, we're going to go ahead and take the bite registration so that we can have an oral appliance made to this exact same position that we had the best results with on the pharyngometer. So just stay just like this, Panah. I'm going to just do a little bit of bite registration in there, okay? And this only takes about a minute to set up. Good, you're doing great. Good. Just stay closed just like that for just a minute, and that'll set up. Okay, Panah, I'm just going to have you open for me. Good. Perfect. You did great. Good. Okay, and you can close.
Okay, you've been through the process of the questionnaire, the symptom evaluation, the tests that were done originally on Panah, followed then, of course, by the utilization of the pharyngometer and then the rhinometer to assess his volume of airway, and then, of course, the elasticity of his airway. The embolato was then done to verify what we thought was obstructive sleep apnea, and we had that verified by a local sleep center here in Atlanta. We went ahead and then evaluated the ability for us to utilize an oral appliance, and we utilized bite guides or bite shims that would allow us to advance the mandible and open up his airway vertically. And we tried several different ones last time, Panah, when you were here, if you remember. And what we did with the assistants is we evaluated which one appeared to give us the best post-operative result, evaluating again on the pharyngometer to see whether or not that airway, that position of his mandible would be most ideal. Once we decided on the bite that we wanted, we then took that bite registration and models of his jaw, and we sent it out to Respire in New York City, at a laboratory that provides us with this appliance. This appliance was set in that particular bite that we assessed during your tests with us in the day that you were in. This appliance has now been fabricated, and this appliance will hold that same position that we believe is the best position for you to be sleeping in. Okay, so what we're going to do, and what this appliance does, is it gives us the ability to hold Panah's jaw in a forward position. If you're taking a look, there's a screw here for us to basically modify the position of the jaw. If we want a more forward position after further evaluation, we can always adjust that. So it leaves room for adjustment. We can always also open the vertical slightly if we wanted to, utilizing the addition of acrylic or acrylic pads. We're not sure that's going to be needed. It looks like we really did get a good bite registration for Panah, and I believe that this anterior repositioning appliance, with the modifications that have been made, can give you a larger opening of your airway and could minimize the elasticity of that airway so we don't get as much closure during nighttime when you're sleeping. So what we're going to do is we're going to place this in your mouth and get you used to the appliance over the next 2 to 3 weeks, wearing it at nighttime. Probably even before nighttime, just to get used to it while you're still awake. And then what we're going to do is have you back in and have you go through the embolato test again at nighttime to see and to verify that this appliance is working and that we've reduced the obstructive sleep apnea that you've been suffering from. If we need to modify it at that point, we'll probably go back again to the screen and take a pharyngometer to assess the success in this appliance. What we've done today, and when we first tried it in your mouth, is we just did a quick test. And if you take a look at what we found, was actually quite impressive. The collapse test that was done and compared to the original without this appliance in your mouth shows a substantial increase in not only in the volume of your airway, but a decreased capacity of it to collapse. So we're not seeing the same type of diminishing airway obstruction we saw earlier, which was at 0.4 centimeters, and now we're at a minimum of 1.71 with the appliances in your mouth. So we have a much smaller constriction of that airway than we had before without the appliance. So we're very hopeful that when we do the Emballata test again in 3 or 4 weeks, once we get used to it, you wearing it, and that you're comfortable, that we verify that this has actually worked. And what I'd like you to do is, if you can just place the appliances in the mouth. This is the upper jaw appliance. And you'll see that this has been pre-fit for Pinal based upon his impressions. And then the lower appliance if you can, Pinal. Okay. And if you can just go ahead and show, I'm going to just take a look. You'll see the fins in the back. Make certain that he can't set his jaw any further back. So the fins lock in and slide. So they slide on each other as the jaw comes forward, only allows him to go forward. And you'll see the opening in his 2 appliances that allow for his airway. If you can now just breathe in comfortably, in and out. Try to perform or try to gain a snoring sound if you can. Not as bad as it's been, has it? Okay. So what we have now is an appliance that will enable Pinal to sleep in. We'll test it further. We have a good anterior position, a good vertical position of his jaw that has opened his airway, that should diminish the elasticity. We shouldn't see as much collapse. And we'll be following Pinal over the next several weeks to make sure and ascertain the fact that the results of the appliance are improving his obstructive sleep apnea.